Hello, I'm Colin Mellon, Senior Vice President and Head of Fiserv's Healthcare and Insurance Vertical. At Fiserv, our aspiration is to move money and information in a way that moves the world. Our company is focused on accelerating client value through differentiated solutions, developing new capabilities based on market trends and client needs, and finally, creating transformative digital experiences reflecting the changing global landscape. My team at Fiserv is exclusively focused on serving healthcare constituents. We aim to provide greater transparency and efficiency as we orchestrate payment and information transactions among payers, providers, and consumers. I'd like to turn it over to Jodie Braner, advisor at the Benefit Company, who will be moderating the panel on medical care in the post-COVID world. Thank you and enjoy the program.
Well, hello, and thank you for joining us today at the Georgia Technology Summit. We're excited to spend some time with all of you and share some insight into our world and have a wonderful panel to begin the discussion. So to kick it off, I would like to have each of our panelists introduce themselves and share a little bit about their background and what they are maybe most recently have encountered, so that we can kick it off with some questions and you'll be able to leave with some greater insight. So with that, Dr. Angela Fasaro, would you do the honors of starting?
Absolutely. Dr. Angela Fusaro, I'm the co-founder and CEO of Physician 360. I am an emergency medicine physician, and at Physician 360, our mission is really about reimagining the practice of urgent care. So what we do is we go into community pharmacies and really transform them into functional urgent cares by empowering them with access to on-demand telemedicine consults and rapid tests for simple illnesses like strep throat and flu and UTI. We were able to parlay that expertise and the infrastructure we had built around that model into playing a meaningful role in the pandemic, and in partnership with our collaborating pharmacies, rolled out some of the earliest testing and screening programs for COVID-19. There is a neighborhood pharmacy within a few miles of over 90% of Americans, and so the model that we've built really allows us to increase access to cost-effective, convenient, but still diagnostically accurate care for patients, even when they're in, what would be considered a marginalized setting like a rural community. So thank you for having me today, and excited for the conversation.
Great, thank you. Dr. Mike Korchak, would you do the honors?
Sure, I'm Dr. Mike Koriwchak. I'm a full-time practicing ear, nose, and throat doctor. I've been at this practice, Ear, Nose, and Throat of Georgia, for the past 25 years. In addition to seeing patients full-time, there are 4 other things I do. One is I am the managing partner for Ear, Nose, and Throat of Atlanta, which is the largest pod practice of ENT of Georgia. I'm the compliance officer for ENT of Georgia. I'm the EMR champion and EMR computer code writer for our EMR system. And the last thing I do is I'm the vice president of Docs for Patient Care Foundation, which is a healthcare policy think tank. So we've got a long and interesting story related to how we've adapted to COVID and how we've kind of made it from first realizing that it's a big problem. Oh, of course, perfect time for my phone to ring. From being a big problem to getting to where we are now, which is a far more mature sort of situation.
Thank you. And of course, now also we would like to ask Toni Pashley from Sharecare to join us.
Hi, everyone. I'm Toni Pashley, and I lead, I'm the SVP of product here at Sharecare. Sharecare, a local Atlanta company, digital health startup. So I'm excited to be with you guys today. A little bit of my background. For the last 2 decades, I've really been in the space of developing digital products for consumers. Sharecare is a digital health platform, and our platform is offered to employers, health plans, and providers. Those are our clients. and they onboard their employees, the health plan members, or even patients for a provider. And what we do is we offer them digital services, everything from understanding their health to learning about programs, benefits, and services that are offered to them that may be offered from their employer or their health plan. So I am not a doctor, but I have been in the digital space and have been working in health for the last 20 years.
So thank you. I think with that background with each of you, it bodes well for our conversation to talk about, medical care today, the delivery of care, and how patients, consumers are receiving that care in the technical post-COVID era, we hope, right? So to kick things off, I'd like to start a question to you, Dr. Fasaro, regarding patients and patients being in the driver's seat, if you will. Is that the new normal for healthcare? Tell me a little bit about what you've seen and how you would talk to that effect.
Absolutely. So I do think patients are now being they're being given the opportunity to be in the driver's seat of their healthcare. I think COVID accelerated this, if you want to call it, decentralization of healthcare, where we're now moving care into more cost-effective places, into the pharmacy setting, as I alluded to earlier, into the home. So the concept of hospital at home, I think we're going to continue to see care being provided in more and more, we'll call them informal or colloquial settings, non-traditional medical settings. And in that vein, patients are now, just like in every other industry, being asked to be decision makers about their healthcare. So they now have direct access to what kind of tools do I want to own, what kind of services do I want to participate in. So, am I going to have an Apple Watch? Am I going to have a pulse ox at home? Am I going to have a remote patient monitoring service? And I think it's wonderful. I think healthcare is catching up in that way. Technology has facilitated consumers being in the driver's seat in every other vertical. I think, again, COVID accelerated that for healthcare, and it's a wonderful opportunity, but I think it comes with some challenge, which is just that we went from one extreme where we had maybe a more, paternalistic relationship with our care providers, with our doctors. They were the primary decision makers. They were telling patients what to do. They were dictating a lot of that. And then almost overnight, we were like, the pandemic hit, and they were like, okay, patients, now you kind of figure it out. And so I feel like now what we're seeing is patients are presented with like that challenge of paradox of choice. It's like, here are a million apps, here are a million products, here are a million services, and I can have all of them, but which ones are the most relevant for me? And which ones are going to give me data that can be most helpful for my personalized care? Because arming someone with data without any clinical relevance is almost as detrimental. So then it's like, got all this information, I don't know what to do with it. If my pulse ox says 96 today as opposed to 97 yesterday, is that clinically significant? And so I think what we'll start to see is a normalization where the products and services that are the most helpful are the ones that still allow for that clinical expertise tie-in. That way you have almost like a filter for the data that the patients are receiving. They have a way to know what the actual significance is of that data.
Absolutely. And, I heard earlier, Dr. Korchak, you had said that you are the EMR champion for your practice. So from that provider perspective and as a follow-up, would you like to add a little to that effect? What are the patients that have this data now doing with it, right?
Sure. The first is I'll give you a little different perspective of what the pre-COVID world looked like to us. Angela, you kind of said that it was very much, doctors kind of dictating everything to patients. I think what was getting dictated to patients wasn't so much the actual medical advice as it was the venues and the methods by which they were getting that advice. And that those dictums were not coming from physicians, but they're coming from the third-party payer system. For example, in telehealth, we've always wanted to do telehealth, and we've always had a feeling that there was a place for it. Classic example being if we do some testing and the results are uncomplicated, it would be nice to be able to do a telehealth visit as we do now. But we wanted to do it before COVID. and say, yeah, your test results are normal, or there's not much more to do here, and save the patient a trip in and a copay and parking and time off work and all those things. There was only one reason that wasn't happening, and it was because there was no way for third parties to pay for it. The rules were, onerous, and nobody was doing it. And in fact, telehealth prior to COVID was the sole space of the insurers, right? Blue Cross would go out and buy a, ask a doc after hours product. And so insurance members, as a member of an insurance policy, not a patient of a practice, could, get a doctor or a nurse on call who they'd never met, who could be working thousands of miles away. I looked for telehealth products for a physician's practice years ago, and they simply didn't exist. A couple of years ago. Now, all of a sudden, CMS did a very good thing when COVID came along, which was to get out of the way and say, okay, we will pay telehealth visits for level 2, 3 at the same rates. All you got to do is put a modifier on it. The documentation requirements are the same. We're going to relax the privacy. You can use your iPhone for it if you want. And so it proved that, get the regulations out of the way, and healthcare will pivot in an instant, because that has been a long-standing accusation against healthcare and physicians specifically, which is that we were all Luddites, that none of us could change the way we did things. We proved everyone wrong, not we just doctors, but the entire system, of course. And get the regulations out of the way, and we'll respond to patients' needs in a heartbeat. And that's exactly what we did at our practice. And of course, that's what happened nationwide. We've seen those statistics. So I think that it's a different world now, but we adapted very quickly. The same thing would have happened with EMRs in the first place had we been given a similar environment.
So Toni, would you like to add from your industry perspective some insight there, having kind of heard the inner dialogue and kind of the evolution of where we've come from to date?
Yeah, I would just sort of echo some of what Angela was saying earlier about sort of this decentralization. A couple of trends that we're seeing, I think we all agree, COVID has really made digital go from sort of like this nice to have to really a must to have. And I think in the trends we're seeing, we don't see it's going to change. I feel like everybody's sort of new normal is going to be about adopting more, what I would call more digital tools, more digital services in healthcare. And I think that's just sort of the state of where we are today. Even with vaccines and going and scheduling your vaccine online at the local pharmacy, that's just sort of expected right now. I would just say a couple of key trends that we're seeing are one, more than ever, we're seeing high levels in mental health of stress, anxiety, and that's driving a lot of people to look online for help, for services. And so, there are a lot of programs out there now. We've seen even a lot of payers being offering certain programs to the population based on where they live, and knowing that there's a high increase of stress and anxiety. So that's one is really looking at the data and understanding your community and your community's population and what's happening. So that's one thing we're seeing as a trend. Two is home services. Everybody was asked in the past to go to get their biometrics testing, go to the lab and do that. And then when COVID happened, that just completely stopped. And so what we saw then were a lot of immediate sort of people triaging and figuring out, how do we bring this into the home? And I think that sort of parlays into sort of that final trend of home services that we're seeing. Really, I think, there's a couple of even diagnostic testing companies that I've read recently have seen a huge increase in those home lab tests and diagnostics. And this idea of really just, in going back to the original thought of distributed and sort of thinking about what you would normally go to one place before to do, now it's been distributed. So it's no longer just about sort of this internet of things of I'm wearing my Apple Watch. It's really this idea of now I'm actually thinking about this internet of healthcare things, like this internet of health and care. That's more about sort of, did I schedule my appointment online? When is my telehealth visit? Where's my health information that I'm storing? So it's really thinking about things, completely differently, I think.
So I think we all agree that it did help make that fast forward happen, but I still think there's some challenges happening. And you also touched upon, that delay in care that took place last year. And so is there a tsunami of catch up about to happen? Those that didn't go for preventive or follow up as expected, et cetera. Maybe they're more now ready to adopt that technology, understand and have embraced it, but where are the challenges for us at this moment? So I'll just sort of open that up to all of you and then get your insight. Dr. Korchak, would you like to start with some thoughts?
Sure. We're still on the steep part of the learning curve regarding telehealth. As much thought as we had given it prior to COVID, a lot of the assumptions that we carried into telehealth, in a big hurry, of course, have turned out to not be accurate. Probably the biggest one is how you handle, the equivalent of what happens with an in-person visit, right? In-person visit, you leave work early, you fight your way across town onto a medical campus, park your car, get in the waiting room, check in, go to an exam room, all this stuff that is a lot of extra waiting and a lot of extra costs that we'd like to do away with in many cases. And what we discovered is it's not quite as smooth as all that in telehealth. I thought it would be very efficient. It's not terribly time efficient because you spend a lot of time going back and forth to get the patient the link and to get them to check in. And it's a lot slower getting started than we anticipated. And that's fine now. We're seeing probably 1 or 2 telehealth patients a day, per doctor. I saw 2 today. But it takes a while for the doctor and the patient to find each other through the platform. And, you spend more time trying to figure out how to get connected than you do actually doing the visit. So there's got to be some sort of infrastructure that we build on the front end so that if we're going to see, 10 telehealth patients in a row, that we can do those in a similar time frame as we can when they come in person. And there's a lot of cultural norms that need to change. I mean, we discovered that if somebody had a 2:00 in the afternoon healthcare visit, and we were a little behind because we're mixing telehealth and in-person visits now. And if we're running a little bit behind, if their appointment's at 2:00, at 2:01, bam, they're making the phone ring going, where are you? And, we've got to realize everybody's going to need that phone call ahead of the visit to sort of fine tune the time, depending on exactly how our day is going, which is not entirely predictable. So still got a ways to go. There's cultural norms that need to be established for what happens. And, that'll happen. It's just, we just haven't had a lot of time, right? We went from going snail's pace to, so accelerated, nobody can keep up with it. So that'll all equalize out.
Angela.
Sure, I will add to that. I think a couple of the challenges that we're seeing, to echo what Mike was saying, I think we, as clinicians, as doctors, as nurse practitioners, as providers, we need to recognize that now technology is a tool to us comparable to like a stethoscope, right? So I trained for a decade to be able to use my stethoscope or my reflex hammer or my whatever, enter tool here properly. I think now we just have to understand that being able to properly leverage the technology platform that you're using to interact with patients to properly utilize all the peripherals that can be used as part of the physical exam, we need to be just as, adept at that as we are at the traditional tools of medicine. So I think part of it is a training issue. We're, rapidly sort of implementing this new way to practice the physical exam. And I think part of that too is us learning how to communicate that to our patients. So the logistics of it, but then also if you can't get a patient comfortable with the new way of connecting, I think, compliance will suffer, and all kinds of, you'll have fallout from the fact that the engagement is not the same. So I think we as a medical community are kind of learning, we're ascending that learning curve in real time. I think as is with any situation, that the pandemic really highlighted disparities. I think this is another challenge. And so when we start to talk about technology and now this being the new normal, I think we, be remiss to not acknowledge that not every community has access to the same level of technology. And so, how are we going to make a platform that has interconnectivity, that has accessibility across condition, across socioeconomic status, across broadband internet access, across, disability. So just thinking through how do we create a really inclusive digital environment if this is in fact the new normal. I think that's also something that's rapidly changing.
Well, I think that points nicely to Toni. You, with your expertise with digital platform and the evolution thereof, what would you like to add?
Yeah, no, I totally agree. And I had mentioned earlier that, we have a lot of data on individuals just in the digital platform that we have at Sharecare. We also have a community well-being index where we're understanding not only SEOH 2.0 factors, so like what was just mentioned as far as like in certain communities, there's other challenges. It's not just about their own personal health, but it's about the community and how do you make the community healthy. And so we're able to look at that data. And I think using that data is something going forward. Again, as I said, it's a trend I'm seeing, at least. We're seeing it in the industry. We're seeing it utilized by more and more companies to really look at who's being impacted the most. And I think, just to echo what, again, Angela was saying, is that I think not always will technology serve a solution, but, at least understanding where those communities are, I think is really important, in identifying them first and foremost so that we can make sure that we can give them access to the right things. I was just going to say one other, just one other thing is, you're right. Like when things sort of shut down, like I guess it was like in my world, it was about March, like everything just sort of shut down like end of March last year.
Yes.
There were a lot of, and I'm guilty of this too, but like preventative exams that sort of everybody stopped doing. And so I think you hit this, Jodie, is that we are, and I'm seeing this, is that we're seeing a lot of requests for, communicating with people about, what we call these gaps in care. So this messaging around, hey, you really need to get back and get that preventative exam, or, that, colon cancer screening you put off, you really need to go do that. So we're also seeing sort of like things starting to pick up again, where people are being notified, and we're really trying to get in front of individuals to let them know about those just sort of standard preventative exams, preventative screenings they should be doing.
I think that's excellent. And with that, I think people are
throw
more
one
apt
comment in
to,
real quick.
Yeah, go ahead.
I totally agree, Toni. And I think that one thing that we have seen that has sort of broken down the barrier is once healthcare folks got vaccinated, people were less afraid of coming. Because I don't know, there's a technology that overcomes, we don't have virtual colonoscopies, no touch colonoscopies yet. So people were afraid. Yes.
Do it.
There is technically, I guess, a virtual colonoscopy, with the point being that a lot of this requires, that you enter the same room with somebody who's been seeing lots of other patients all day. And there was a big fear factor that went with that. But we're seeing in the last 6 weeks that, we've broken through sort of that 80% of pre-COVID volume. And I think it's been the vaccine that's made people say, yeah. And I've had patients actually say that, which is, I'm back now because I got vaccinated and I know you got vaccine. So, let's pick up where we left off.
Great.
Well, that's promising. So how about we all chat a little bit about what were some unexpected lessons? I really think that is the interesting part of what we've all grown through. And I say grown because it was frightening and we all embraced our fears, and look at us now. So, but I like to think of my glass as being half full, so I can't help it but look at it that way. I know there were a lot of unfortunate events, but if we could look at it from that perspective, unexpected lesson from COVID, and what did we take advantage? How do we take advantage of those lessons? And what's in the works? What do you, if it's not within your industry expertise or silo, if you will, what are you seeing that may impact what you're going to do upcoming? I'll let any of you start. Toni, would you like to grasp that one?
So something that was unexpected, and then maybe sort of like something that we're moving towards. Well, unexpected was just the takeoff of video, like video as a just ubiquitous, like everyone's using video, kids are on it all day, right? I mean, it's just sort of amazing. I mean, my 83-year-old mother is on video all the time now. So I feel like that was sort of unexpected to me. I think also there's probably going to be some interesting things we learn just from a digital standpoint around how children who are in front of their computers all day, learning, and how they've been removed from the classroom, how that will affect sort of how they learn. I mean, this is outside of sort of medical, but just, you said interesting. And then also I think just sort of like their associations with computers as well, because some, that may cause some different associations than we expect. But then I think there's also some expectations now. I think it raised the bar, and this is sort of looking forward, maybe more optimistic. I think this touches on a little bit of what we were talking about, but I think it's raised some expectations as well. Everybody's ordering Amazon, having it delivered to their home. Everybody is expecting to be able to get their vaccine, get it right away. I think people's expectations of using technology, getting things delivered to them is much higher now than it was previously.
I agree. And even though your comment about the children learning and all and the video access, it does apply to medical care, because that is a part of the telemedicine delivery, right?
Yeah.
So Mike, what would you like to share?
Totally agree with Toni's comments about the video. I'll add another facet to it, which is that doctors started using video, and I'm not just talking about to communicate with patients, but one of the problems in our specialty of ENT is that we were very high risk as a specialty, right? For us to do our job, we have to get our face close to your face. And there were a couple of ENTs on the West Coast that died before we fully understood what was happening. And so we had a real sort of panic that came along again right around March of last year as to how are we going to get back to doing this safely. And so we started looking into ways to, where we'd usually, put our eye down to the scope to say, how can we do this better? There's been video carts available to us for years, but they've cost $25,000 to $30,000. And so with the extra time that we had on our hands when we were shut down, I was like, okay, this is ridiculous. I'm going to get on the internet. I'm going to look at the pieces I've got in my office. And I put together a Franken cart, a video cart, spending no money at all, and figured out how to plug the endoscope camera straight into the laptop, get open source software to do it. And so I can do any exam that I could do before I can do on video, and I video everything now. And it's proven to be great. It's a great patient education tool. It's a great record keeping to look at old photographs versus new. And, COVID sort of gave us the nudge to sort of get over that hump and actually get that going. So totally agree on the video. Other unexpected lessons, a couple I already touched on. One is how fast healthcare was able to pivot when the regulatory barriers were out of the way. And I think that dispels a lot of myths and a lot of accusations. Talked about that. The other thing is that, we still have a high mountain to climb to get telehealth where it needs to be. We're all using telehealth as sort of a separate add-on product in most cases. We're looking at a new EMR for next year that incorporates the telehealth as part of the EMR product and not a separate thing. So a lot of evolution there to go. And lastly, and I'll sort of step outside the IT box briefly. It was interesting to see as a physician, the shock and awe of society as a whole when they see that science and medicine and politics are all inexorably connected. That's something that's been clear to us for a long time, because no matter what research you're doing or what opinion you have, somebody is financing in the background, and those folks are going to have a certain financial or political interest in a certain outcome. That's been around for decades, if not longer than that. But now, of course, with COVID, that's been brought to the forefront. It's not as surprising to physicians as it has been to everyone else.
Thank you. I agree. And so, Angela, what was your unexpected event that occurred from our last 12 months?
Toni and Mike took all the good answers. I agree with everything. I do. I agree with everything that's been said. I saw, a parallel as far as even creative use of video within the clinical setting. So I still practice a small amount of emergency medicine, but in a community that got hit extremely hard by COVID in Albany, Georgia. And it was a hot spot. And to your point, we started to see physicians, in an effort to protect themselves, using video to interact with patients outside the room, as a way of engaging with consultants. So very much had a similar experience to what's already been described. And I think going forward, just to reiterate, I really think the value is going to be in products and services that connect the dots. I think we had this huge explosion of, I don't want to say single function, but more focused function as far as apps, devices, tests. And I think as we continue with this being the new normal, it will be those products and services that can serve as like the connective tissue that can connect all the dots for the patient, that will really bring the most value for them going forward. If this is going to continue and we're going to continue to evolve, if the technology is going to continue to evolve at the pace that it has been, or even close, we're going to need some kind of grounding anchor that patients know to sort of serve as that home base for them.
And I think we have a few minutes left, but I think before we wrap up, I'd like to just recircle if that's an agreement on the socioeconomic component of the delivery of care now that we're in this environment, and how people are more accepting now to video and remote patient monitoring and things like that. Do you feel that you had mentioned South Georgia, for instance, that was a hotbed for, unfortunately, the virus to spike up. And we know that mental health, as you mentioned, Toni, earlier, has been a big item that folks are looking for and searching for, even if it was just from due isolation during, the shutdown, et cetera. I think that there is room for opportunity there. If there was one area pie in the sky that you would like to see or have started to see, maybe from an innovation or such, that you'd like to share that could touch on that, I think from a community and a culture perspective, that's consistent, right? We're all looking for that when there's been limited access in the past. That we have this new opportunity through video and through other resources, telemedicine, to get to folks now for that greater access of care. Any silver lining, anything that any of you all would like to share that you've seen bubbling and would look forward to? Mike, maybe you want to kick it off?
Sure. I think I'm the least qualified person in the room to opine on this one. So feel free to disagree, because my level of confidence on this is not high. But it seems to me that the one common denominator, regardless of socioeconomic status, is that patients do have cell phones. And it seems that if as long as we can make technology work with an average capability smartphone, that we will have done a very, very significant thing. Because of course we see patients across the socioeconomic spectrum. Everybody has a cell phone, and if we can, and that's not as easy as it sounds. I can tell you that just from the fact that we do telehealth off cell phones, and it can be a big struggle. But if we can perfect that technology and come up with platforms that can rapidly and seamlessly sort of, detect the weak spots, compensate for them, and build an infrastructure around that kind of thing. I think we could reach a lot of people and probably leave fewer behind than any other model. But again, I defer to the smarter people in the room on this question.
Toni, would you like to share? I think you're spot on. I think you're right. I agree 100%, but I'm curious, other thoughts?
Yeah, I totally agree with Mike. We know that people have those phones, and being able to reach them by the phone is definitely, I think, one key thing. I think also, I'll just use the example of the mental health one. We did see that during the pandemic. We're still seeing that right now. And being able to reach those individuals who have a smartphone, being able to give them a program, and someone that they can talk to, I think has been huge. As I mentioned, using the data to understand sort of like in Arizona, for example, we had some data showing like 1 in 5 were reporting severe anxiety due to COVID-19. And so we partnered with a company and they offered a mental health program, anxiety, to those individuals for free. So I think things like that, where we can make it accessible, one, obviously accessibility is very important, but then knowing in that population what the biggest need is, I think is also, an important thing that we can do, especially to underserved populations as well. So I totally support Mike.
Ditto. Angela.
Part of the, I think part of addressing disparities is being conscious of them at the design phase. I think this happens with everything, which is that something gets built for a majority. So if it fits for the majority of people from the perspective of the type of physical environment they're going to be in, or the type of income level that they have, or the type of accessibility. So we start with something that fits for the majority, and then kind of after the fact, think about, well, how do we design for everyone? And I think if we could flip that around and at least just be conscious from the get-go of, is there a way to create a design that is all inclusive out of the gate? Now, it's very difficult to do that, but I think just being aware of how health disparities impact design from the get-go is one thing that I think we're starting to see. Since COVID made those disparities so undeniable, I think more people have it on the forefront of their mind as they create new technologies. I think the other part of this that I'll highlight, because it's relevant to what I see every day, is that a lot of different systems have been put into place, and they are they're serviceable in one type of environment, and that typically tends to be an urban environment. And we see a lot of companies playing a role there. I would love to see the expansion of, okay, how do we reach rural communities? How do we reach tribal communities? How do we, again, create a more versatile system? Because it's those individuals who are most at risk, they're most marginalized. So, not that we don't need, another version of Amazon Prime in the middle of Atlanta, but perhaps we need something that's more relevant, like in the rest of rural Georgia, because there's just fewer options there.
Agreed. So
I would say
pie
no
in the
need to
sky
assume
would be that connectivity.
I would say no need to assume that one size has to fit all, though. If we can make something that reaches 3/4 of the people, and like you said, Angela, acknowledge from the very beginning of the design stage that what you're doing as version 1.0 is underserving the remaining 25%, you don't wait 10 years to realize that. You figure it out, as soon as you're rolling out 1.0, you acknowledge right up front, before anybody else even has a chance to suggest it, that this is a good start. It is not a good end.
Totally agree. And I mean, I read Scrum, I'm all about it. I'm not saying that we delay, the release of technology until it can service everyone. I just think we have to be, as you just said, very conscious of the fact, where are the limitations from the get-go so that we
Yep.
can more quickly address those gaps. Absolutely.
Yep.
Well, great. You all, I appreciate all of your input and thoughts. I think that's what the intent of getting together today has been, to talk about the unknown. We've come from the unknown and we're moving into the unknown, but we can take our experiences and really grow and learn from them. And it has been a fast forward, I think, in the right direction. By keeping these conversations open, like this dialogue, we're going to have even better improvements, I think, in a quicker fashion. So thank you for joining the Georgia Technology Summit today, and you all have a good afternoon.